want to have more of these discussions to really move the needle on public health workforce. I want to thank the panelists for their really informative and energizing remarks and for your leadership. And it's now my pleasure to introduce Kristen Bibbins Domingo. She's the co-chair of the Roundtable on Population Health Improvement. And thanks to the audience as well.
Thank you so much. This has been such a wonderful day and really a set of rich discussions about the importance of our population health workforce opportunities and challenges. I just have a few reflections on a really extraordinary set of panel discussions. We began today talking about what a population health workforce is, that it is something that is beyond just traditional governmental public health, that the population health landscape is broad and includes traditional governmental public health. It includes health care, includes community-based organizations, the social sector, policymakers. It includes those who are actively engaged and would recognize themselves as working in population health, as well as those whose work is important for population health, but might not actively recognize that that is the work. I think the opportunities that we saw were really so extraordinary because they really highlighted how much the pandemic has really made visible the importance of this broad conception of population health, as well as the workforce that's actively engaged in it. We saw innovative programs from across the country, from New York, North Carolina, Indian country, Oregon, Rhode Island, Michigan, just to name a few. These programs were characterized by innovation, by cross-sector collaboration. They were tailored to the needs of their environment. They used data, and they all had a very strong component of community outreach. One of the things that was really critical for me is seeing how much was invested in the workforce that was accomplishing this on-the-ground outreach. And we saw the community health worker models, I think, in various manifestations, and how they have been a critical part of this workforce, as well as the opportunities to professionalize a workforce like this community health worker workforce, valuing the varying expertise that people might bring to the table as they come to be involved in working in public health, but also providing the opportunities for growth within these community health worker models. I think we also saw the challenges today, the challenges that we are talking about a workforce that has historically experienced underinvestment, and that the issues of equity, which are so important to the work that we all want to engage in, are important for also thinking about how we build this workforce. I think importantly, as we think about a workforce that spans sectors, we have to recognize the issues of equity across these sectors. I'm speaking from this as somebody who comes from healthcare, and recognizing that healthcare is both part of the solution for advancing population health, as well as oftentimes part of the problem with the oftentimes privileged position that healthcare has. The inequities across these different sectors, we also see when we think about community organizations and a population health workforce that might be sitting in community organizations, but the differentials and power differentials between these sectors, I think, makes issues of equity in the workforce front and center. And even within a single sector, we heard today that within governmental public health, that we have important issues of inequities across opportunity, across leadership, across compensation, whether this is issues of diversity or gender equity, that these are issues that we are grappling with right now. I heard many optimistic comments here, but the importance that if we want to do this work equitably, we need to be able to figure out how to create capacity for equity work and then scale this capacity equitably. I was really struck by the comments about how much of a toll the past several years have taken on this workforce, and how even before the pandemic, this was a workforce that was prone to people leaving to go into other sectors. And that's something that's going to be important. And I think this last panel also highlighted how important the data gaps are, and even articulating, enumerating who is in this workforce, what types of occupations are in this workforce. This is a broad field, not an occupation, but if we don't know and cannot enumerate who is in this workforce, we will find it and always be limited in our ability to scale, in our ability to finance, and certainly in our ability to do this equitably. I think the things that gave me real hope today was seeing just the extraordinary passion for this work, and the many people who've come together in thinking about what is needed for the workforce. I think we have seen the innovative models, we have seen the opportunities, and we've seen the challenges. The two things that give me hope that I would call out as a part of the day are taking the historical view. I think our first panel really highlighted that this tension between how we think about and define population health, how we think about and define public health in the sphere, how we move between a very holistic view of advancing the health of the public away from a very narrow reductionist view. This is something that has defined our fields for a very long time, and this is just the latest manifestation. And how we support developing a workforce is just one next step in this long arc that hopefully is moving us to a better ability to address the health of the population. And then also in our first panel this morning, we also had the analogy of the two superpowers that we might also want to grapple with. Do we want invisibility, or do we want the ability to fly? And the good thing about this pandemic, as we were reminded this morning, is that it has made the public health workforce much more visible. It has highlighted the importance of population health broadly, the importance of social justice and equity, the importance of multiple sectors working together, and a workforce that works across these sectors. It has made us more visible, but we don't just want to be visible, we want to actually fly. And at the end of the day, I think extending the discussions that we're having today and ensuring that the students we heard today and their vision for the future, I think should give us all the encouragement that we need to both recognize the challenges, but work together so that we can all fly to advance population health. Thank you all for joining us today. It's been a really wonderful discussion, and appreciate the work of all of the speakers as well as the organizers. Thank you.